A distinctive factor of osteopathic medicine is its use of the hands for diagnostic and therapeutic purposes, known as osteopathic manipulative medicine. Every aspect of OMM requires some level of force to be placed on the body to identify areas of restricted motion and tissue stiffness. Since the beginning of the profession, students developed their OMM skills by watching live demonstrations of manual techniques performed by an experienced physician. Then they would practice what they observed, trying to mimic what they saw and feel what was described. And while technologies used in teaching OMM skills have changed to increase the number of students who can observe an instructor's demonstration, the overall teaching process remains demonstration followed by practice. And while occasionally an instructor may give recommendations to refine skills, in general, palpation skill development occurs from unsupervised practice. This training allows for ubiquitous variability in how hands are used and interpreted. Within a science-based discipline, applying diverse skills in practice and research produces significant problems. Osteopathic physicians determine what treatment techniques they perform based on how the body responds to the forces placed on it. DOs often compare one hand to the other to determine if joint movement is restricted or tissue or muscles are tighter or stiffer on one side versus another. Over the last 10 years, we have used instrumentation on hundreds of osteopathic clinicians and have consistently shown large asymmetries in force produced by the hands during examination, causing reversal of diagnoses and choice of treatment techniques. So to address this major persistent limitation in OMM training, we developed the Force Calibration Kit and training modules. This kit consists of everything needed to get objective feedback on forces being applied by both hands. This system allows the trainee to perform the technique as it would be performed on a human. The trainee pushes on sensors that are under the simulated soft tissue gel pads. The upper screen or secondary iPad provides instructions how to use the instrumentation and to complete over 12 modules that help the trainee build their skills. The lower iPad provides graphs and tables for feedback. With alternating pushes between the two hands, students can compare the forces produced by their right and left hands. They compare peaks between a pair of pushes to make sure they look similar with smooth peaks and be within 10% of each other and in the green target zone. And in this column, they can see the specific value for the percent difference between the hands and a color scale that will help the examiners immediately see how they are doing. 2 years ago during COVID, this system was first pilot tested in an OMM elective for upper class students. This calibration system allowed for independent yet standardized training with objective feedback at home, which over 2 months resulted in significant improvement in their production of comparable forces. This past summer, we reinitiated the Advancing Skills in Osteopathy CME program, where manipulative medicine and therapy specialists come from around the world to Kirksville to receive this training. And for the first time this semester, the entire first-year class at KCOM used this system in 3 labs to give students objective feedback to direct their skill development. This instrument and learning modules are engaging, cost-effective, and provides an objective way to perform quality assurance and attract quality improvement in students' OMM skills.